Hey, welcome to the Go to Physio Lumbar series. In today's content, what I want to go through is how to make sense of the toe touch. So we've talked a lot about the importance of the ribcage to depress, the diaphragm to lengthen, the pelvic floor to mobilize in order to take excessive load off the lumbar spine. Well, in today's content, I'm going to show you how to break this down for the toe touch so that you know where to start with your hands-on treatment. With that said, let's get straight into it. Okay, so what I want to encourage you to do with your objective assessment is consider other areas in the body that's maybe not doing their job, okay, or have limited movement options that may be putting excessive force on the lumbar spine. And then the other thing I want you to consider is when that actual pain experience is present during the movement. Okay, so I'm just going to do a toe touch here, and in the mentorship we go through this in a lot more detail, but I just want you to open your eyes as a new grad, okay, and just start to consider the options when you're looking at your objective assessment. So it's very easy just to go through the motions and have not a good thought process or clinical reasoning as to what you're about to do next based on what you find in the objective assessment. So when Pete touches his toes here, there's literally 101 things we could look at with this, okay? But what I want to look at here is when does Pete's pain experience start, and maybe what should be contributing to this movement at that point, okay? Then I would ask myself, is that area of the body contributing at that point? Or is it maybe not doing what it could do, which could potentially contribute to maybe the lumbar spine doing excessive motion or having to produce more force, which would then contribute to that sensitization of tissues, which would then contribute up to that higher centers, and then we've got this conscious experience of pain, okay? So for example, Pete, just go to touch your toes and then pause it there. So if the athlete said to me, okay, I've got pain here and it comes on here, that's going to be very different for me than, Pete, if you go all the way down for me, okay, I just get pain at the very end, okay, or come back up again, or I just get pain on the way back up, okay? So we've got a few options with the toe touch. So some people will go, I've got pain here, now it's gone, and now I'm fine, okay? Other people will go, yeah, it's just at the end now it comes on, or someone else might go, yeah, it's just as I'm coming back up, okay? So I just want you to take a moment and consider the three different options or possibilities of how you would approach those patients, okay? So how would you approach them? Would you give them the same exercises? Would you do the same treatment based on that pain experience for each individual patient, or what would you do, okay? And this, you know, this could be hard to get your head around at the start, especially as a new grad, but this is the whole point of this website, is to encourage you, hopefully open your eyes to maybe different possibilities clinically. So let's go through it. When Pete touches his toes, what's one of the first things that has to happen, okay? So Pete, just go to touch your toes, pause. Okay, look at his rib cage, okay? So Pete's rib cage has to depress, okay? What did we say, back up again? What did we say is one of the first things that has to happen in order for that rib cage to depress? Okay, so if you recall from the previous lessons, the diaphragm needs to lengthen as that rib cage depresses. Okay, so now hopefully you can see the importance of restoring the ability to nasal breathe and slowing down that respiratory rate and improving that respiratory depth. Okay, so if we can keep that diaphragm nice and mobile, and that's going to help that rib cage depress, okay, which is going to help the abdominals to contract, okay, which is then hopefully going to help that athlete maybe move more efficiently and giving them a bit more movement options, okay? What, on the other hand, if that athlete couldn't maybe depress the rib cage as efficiently as maybe he should be able to, then what you're going to see, from my experience, is a lot of athletes, when they go to touch their toes, is we won't see much rib cage depression, and we'll just see him almost reaching outwards. So straight away then, as I reach outwards, I'm feeling a lot more force on my back, on my lumbar spine, okay? Whereas if I have good ribcage depression, my lumbar spine's not really getting involved at this point, okay? Whereas if I don't have good ribcage depression and I go straight out, now my lumbar spine extensors are almost working, okay, concentrically, when actually if I've good ribcage depression, they're lengthening, okay? So again, when I go to touch my toes are down there. How is that athlete achieving that? Can that athlete go straight down, or does he have to come out in order to go back down and touch his toes? So again, what's the more efficient way for that? That's just a question I ask myself. Okay, if I want to touch my toes, you know, go down and touch your toes. I shouldn't have to go out here to then get there. So what's my body working around to say that I have to go out here in order to get back down there? It's just a question I ask myself. And one of the things I find is that the rib cage very often will be very stiff, and we have lost the ability to mobilize that diaphragm, mobilize those intercostals, and then very often we lose movement options. So then I see that the lumbar spine is a slave to that, and ultimately that's taking a lot of excessive force. So again, if Pete can't do that, okay, and he can't depress that rib cage, then that lumbar extensors are generating a lot of torque to stabilize his body. Okay, is it possible that that excessive torque there maybe at a time when he shouldn't maybe be using these muscles in this situation appropriately for how they're designed? Could that be contributing then to sensitizing these tissues or these nociceptors that ultimately then is contributing to that signal going up to the higher centers, and then the higher centers then perceive this as a threat, and then that athlete all of a sudden has a pain experience, okay? So what we would do then, if that was the case, and I'm right, if I'm right in my hypothesis here, is if we could get that rib cage, okay, and that diaphragm to mobilize, then we can give that athlete back movement options. So when that athlete goes to touch his toes, he can actually use as many different options as possible, so then that lumbar extensors isn't having to work excessively to stabilize the body. Because if he has good contraction through the abdominals, then his rib cage, his pelvis is going to be stabilized, okay? Then he shouldn't need excessive contraction through the lumbar extensors, okay? So very often you see a lot of people, they're bracing as they go down, okay? They're using excessive contraction, they're almost going rigid in order to move, okay? So this movement strategy. So what we want to do is we want to encourage this relaxation and give the athlete as much movement options as possible. But for me, that always starts with the rib cage, because the rib cage has got so much movement that if we can get that movement back, it's not only going to help the length tension relationship with the abdominals, but it's also going to give us a lot more options to move, okay? So that first bit of movement, when that athlete gets pain, okay, I'm suspecting, okay, maybe that diaphragm needs a little bit of encouragement to lengthen. I'm not for 1 second saying the diaphragm is the cause of the back pain, because then what we have to ask ourselves is, why has that diaphragm lost the ability to lengthen in the first place, okay? So the diaphragm's lost the ability to lengthen and shorten in the first place due to the stresses on Pete's life, which is completely individual to Pete and nobody else, okay? So the diaphragm is a reaction to something else, but the diaphragm is something that we can influence quite easily with the breathing and a few other little drills that we can encourage that diaphragm to mobilize again. But we still may want to help Pete decrease these stressors that's causing that diaphragm to maybe go a little bit hypertonic in the first place, okay? So the start of the movement is Pete touches his toes. Pete, go again. I want good movement. I want good rib cage depression. I want these tissues to lengthen. Okay, and I want these lumbar spine muscles to pretty much relax or work eccentrically, okay? I don't want them to be braced and contracting, and then as that athlete's asking those muscles to lengthen, they're still contracting, okay? That's a recipe for disaster in my opinion, okay? Because the athlete wants them to lengthen, the nervous system's going, not a chance, I need these to stabilize your body and keep you safe, Pete. So there's a massive prediction error there happening of what should be happening and what's actually happening. And then potentially that's contributing to this pain experience, okay? So that would be the first thing. Now let's consider someone who gets pain at the bottom of the toe touch, okay? So Pete, if you touch your toes, moving good, he's got good options here, and he just says, yeah, I just feel it at the end of the movement. Well, what's the difference here, okay? So what's the difference between this and the start of the movement, okay? So we know now that he's got decent rib cage depression, he's coming down, then maybe that's something at the hips as well, because if we move well at the hips and the rib cage, the lumbar spine isn't going to have to do anything excessively, okay? So if you come back up again, so as Pete touches his toes, look at the hips coming back, okay? Pause there, Pete. come back up a tiny little bit there. Okay, so as Pete goes to touch his toes, that lumbar spine's pretty flat there. It's not doing a massive amount of work at the moment, but what he is doing is he's coming back into hip flexion and ribcage depression. So ribcage and hips are very, very important. Okay, so if the athlete's getting pain at the end here, okay, maybe I'm considering is something here not lengthening, okay, or carrying some kind of protective tone. Okay, and back up again. So I hope you can see, and what I like to do sometimes, whether this is right or wrong, I'm not sure, but I like to almost give percentages to each body part so the patient can understand this. So if I feel that the athlete's not moving well through the rib cage, okay, and he's got back pain, and then I'm explaining to the person what I think is happening, then I would say, okay, for instance, Pete, the rib cage, all this area needs to do 25%, the back needs to do 25%, the hips and the glutes need to do 25%, and the lower limb needs to do 25% for argument's sake. I appreciate that everything else is working as well, but just keeping it simple for the patient. Now, Pete, if this rib cage and these hips aren't doing their job, then all of a sudden the low back may have to do 50, 60, 70% of the work in order to stabilize your body as you're moving. Okay, so then what usually tends to happen is as those tissues are working 70% instead of 25%, they get a little bit angry, they get a little bit tired, they get a little bit fatigued. So then they might send a message to the higher centers potentially saying, hey, I'm doing a lot of work here. Then the higher centers may say, okay, tell you what, I'm going to give you a little bit of pain so that I'm going to get Pete to change how he's moving to help you guys out. Okay? So then what you might do, Pete, is you might change your strategy, or you might do something to take action to this. Now, you might know what to do because you're not a trained physio, okay, if this was the patient. Then, so that's why you've come to see me to help you get the back to movement, Pete. So for your back pain, Pete, what we're going to do is we're going to try get as much movement as we can through the rib cage. We're going to get the hips to help out a little bit. So then when you do your movements, you touch your toes and you lift your baby up, this will do 25%, this will do 25, this will do 25, the legs will do 25. So then when you're doing these actions, the lower back muscles and all the areas around that, that's only doing 25%. So that's not going to be cribbing and whinging up to the higher centers. Does that make sense? Okay, so that's maybe an example of how I would explain this to the patient, because then with my treatment, if I'm trying to help this to move better, trying to get this to move better, then the person can maybe understand a little bit more. Okay, it's my back, but he's working on a lot of breathing with me. Okay, why is that? So if he can understand this kind of concept and he's trying to get everything else better, then from my own experience, the patient tends to buy into this very, very quickly. Okay, so the last one we need to do is pain on the way back up again. So Pete, if you go down, okay, no pain on the way down, and then come up again, oh, just there I get the pain. Okay, so what should be happening here? Okay, so where should he be generating torque here as he comes back up again? So he's gone into extreme flexion. Okay, good, and now he needs to come back up again. So he needs to hip extend. Okay, so this is how I work this out. Okay, what has to happen? He has to plantar flex through the foot, he has to hip extend, and he's going to extend through his back a little bit. Come back up again, Pete. So if his back has pain here, then I'm suspecting that potentially these tissues are generating maybe a little bit more torque than they need to, which could be contributing to this pain experience. So then I would say, okay, if this has to do 33%, this has to do 33, and the foot has to do 33%, is it potentially that maybe one of these tissues muscles aren't generating enough torque, which is causing the low back to then maybe generate excessive torque on the way back up again? So, okay, although he's getting pain here, yeah, sure, we need to respect that and we can maybe help him with some local techniques here. But what I want to do to make sure that this is a more efficient strategy for him is we want to give back the ability to generate torque either through the hips, the hamstrings, the calf, whatever. Okay, so again, that's where we go into a little bit more detailed assessment in our objective assessment. Okay, so for that strategy, if the person was getting pain on the way back up again, so go down again, Pete, touch your toes. Okay, no pain, back up again, no, I'm getting pain. Okay, you're getting pain here, Pete? Okay, so what I'm thinking is, okay, is it maybe a problem here to hips that they're not generating enough torque? You can just come back up again, Pete. Or is he not plantar flexing enough through the midfoot to generate torque through the hamstrings and calf to send maybe energy up to the hip? Is that the problem? Okay, or why is these tissues that when they contract at this point associated with a threat response, okay, or a perceived threat that has a pain experience? Okay, so for me then, I want to figure out what maybe isn't doing its job to cause these tissues to work excessively, or is there something up here? Okay, and again, it's specific to the patient, it's very, very specific to their injury history. Okay, so that's just something to take into consideration. So that is something that I would do, okay? And that's a very, very small snippet of the toe touch test. There's lots and lots of different scenarios that could happen here, but that's just to give you a taste of how I look at the body when I assess, okay? So the toe touch, okay, what's maybe not doing its job at the moment at this point that should be doing its job, that may be contributing to this pain experience. Now, this is for an acute kind of pain scenario. If it's a persistent pain patient, they've come into you, okay, which is, it could potentially happen with sport, but it's not as common, is, that person has got pain with every movement, then there's a potential that there may be some central sensitization coming on. So just keep that into consideration as well. But for your kind of, your general sports injuries that to come in, they've got back pain, or whatever, to come into the clinic, then this kind of way of looking at the body is going to hold true for a lot of them. Okay, so take that into consideration. Then consider this for extension for all your other tests, and for every test you do for your back pain assessment, consider it. Okay, start thinking about this. Okay, what's maybe not doing its job that maybe is causing those tissues to do excessive loads. Okay, and from my own experience, I've never ever seen a weak back. Okay, I've seen some painful backs, okay, but I've never seen a low back that needed a massive amount of excessive work, okay, because I find that a lot of times the low back's doing a great job, and it's actually doing a lot of work when we're lifting, when we're squatting, etc. And what we actually need to do is we need to relax these tissues, and we need to get everything else doing their job. And I like to say that to the patient as well, where I'll say, okay, Pete, from what I've seen here, your back's doing a great job. And that's a little bit strange for the patient to hear, because they go, what? I thought my back's the problem, I thought my back feels weak. Okay, but what we can do then is we can reframe their belief system about that back. Okay, well actually, Pete, your back's just fatigued and tired because it's doing a lot of work. So your back's very strong, which is why it was doing all this work for you, because other areas of the body weren't doing their jobs. Okay, so although your back feels weak, it's not weak, it's just fatigued probably, okay, and it's a little bit tired. We almost need to relax that low back rather than strengthen it, okay? But what we do need to do is we need to get a bit more strength in other parts of the body, and then that'll reframe his belief system about his back, and hopefully give him a bit more confidence in his back and a bit more belief in that back. Okay, so that's the assessment. Take it on board, hopefully. Play around with it, just consider, and then start to integrate this into all other areas of the body as well. Okay, as I said, look, I cover this in a lot more detail in the mentorship, but I just want to open your eyes a little bit to it here, so that you can start to open your mind to it and start to integrate this stuff into all assessments, rather than just going through the motions with every test, but start to clinically reason what's happening and how you're going to do that, then how you're going to use that information for your treatment and also for your rehab. Okay, so I hope you found that useful. Now in the Go-To Therapist Mentorship, we do this for the whole body. We keep it so simple that we use clinical reasoning to see where we're going to start with our hands-on treatment. That allows you to feel liberated in that you don't have to treat everything and hope something sticks. You understand clearly why you're treating something, and that's very important then for the next couple of lessons, where we can see what rehab exercises we're going to give to make sure that we get lasting results. Now, one of the big tissues that you're going to want to desensitize for low back pain patients is the intercostals. So we've already talked about the importance of the ribcage mobility. Well, the intercostals are tissues that I've seen from personal experience can have a lot of protective tone. So in the next lesson, I'm going to show you how to desensitize them. Some of my favorite techniques that I use both with pro athletes and patients, non-sporting patients here in our clinic. So with that said, if you found this useful and you want more of this content, head over to thegotofysio.com. I've got loads of content there for you to help you get the confidence and clarity to look at the body as one without getting overwhelmed, design a treatment plan that's logical, that's step by step, and it gets lasting results that differentiates you as that go-to therapist in your town. You can charge what you're worth, and you can get long-lasting results for any patient who comes through the door. So with that said, I'll see you next time, and I'll give you my favorite intercostals desensitization technique. See you then.